To scan for proximal and distal intersection syndrome, the patient is seated on the other side of the table, hand placed on the table, and then first point to find is Lister's tubercle as a landmark. So we can see Lister's tubercle right here with on the ulnar side we can see compartment number 3, the extensor pollicis longus, and on the radial side we can find compartment number 2, the extensor carpi radialis brevis and the extensor carpi radialis longus. Both tendons are within a tendon sheath, so the tendon sheath you can see right there, and we're going to observe the thickness of the tendon sheath. We're going to observe the cross-sectional area of both tendons, of course also the echogenicity of both tendons, and whether there is a fluid around each tendon. The intersection is a little bit more to proximal, so let's slide to proximal and see what happens. And then if you look closely, you can see that the content of the first extensor compartment, so the APL and the EPB, that they are crossing the content of the extensor 2 compartment. So there you can see the muscle belly of compartment number 1 going over the tendons of compartment number 2. This is compartment number 2, and that's the content of compartment number 1. And there might be a friction right here that could lead to a fluid surrounding these tendons, or in between the muscle belly and the tendons. Even also frictioning of the tendon, which leads to a tendinopathy and increased thickness and cross-sectional area of the tendon. So that is what we are going to observe, and which are also signs for this proximal intersection syndrome. If you would look to the patient, you would also in many cases see a swelling right there. So that is also an indication that there might be an intersection syndrome. This is not the only intersection syndrome we have. So this is proximal to Lister's tubercle. We also have a distal one. So let's first slide back to distal. Here we can see Lister's tubercle again. And we're going to continue focusing on the compartment number 2 structures. But now a different structure will cross these two, and that's the content of compartment number 3. So that's the EPL, which crosses the extensor carpi radialis, longus and brevis. And similarly as proximal, we're going to observe indeed the cross-sectional area of all tendons. We're going to search for echogenicity changes, fluid, and maybe also neovascularization.